to give you the structure within the organization so that you can continue to grow and to develop and intensify your efforts to engage patients and families in your improvement efforts. So specifically around some of the things that we've learned over the last 20-plus years of working around patient-family advisory councils, things that we know really help to create sustainability both for the organization but also from the advisor perspective. And so those are kind of the things we'll be talking about today. I think what's really important, and we just ran into this with an organization that finished the Gateways program about 7 months ago, a really wonderful group in a community hospital setting in an effort to make it a comfortable and easy experience for the advisors, sort of moved away from the structure they had implemented in their charter and really were kind of bending to what the advisors were suggesting or desiring. And so with that, they got so far out of track of what was important to the organization that they were losing impact. The advisors were feeling that they were not having impact, and so they've really hit some bumps in terms of keeping the advisors motivated. They had one actually resign. And so I really, as we move forward, I want to encourage you to design a council to fill the what. Why did you do this council? What was that vision statement? And continue to provide that around the what and not cave to the who so much. And it's not a caving, I shouldn't describe it that way. It's a very well-intentioned effort to, again, make this process of being an advisor a comfortable one for advisors. The further you get away from the heart of the organization and the improvement work going on, the more that, even with that well-intentioned, you're going to start to lose the motivation of your advisors. So design the what. We want to see some expansion of the integration of advisors across the organization. The MCE is a great example of that, but look around for in your organization, what committees, what design projects, work groups, legislative advocacy, if any of your organizations are involved in that in California, to engage your advisors in different areas. Recognize that, again, advisors will come and go according to their own needs, and so we don't want you chasing after people to convince them to stay. Really, it's about looking at the structure that you've implemented, and we'll be talking more about that today, and then really designing a council that's going to have high impact for your organization. So some of the activities for building sustainability is continuous recruiting. You've all put into effect great recruiting habits, and we want to continue to keep those robust, keep those avenues going. Expanding the engagement opportunities outside the PFAC is something that we'll be looking to do, around month 3 or 4. Publicizing the point of contact to the organization, continuing to do that. So the facilitator for the Patient Family Advisory Council, continuing to publicize who that is so the organization knows who to come to as they start to learn more and more about the PFAC and want to become engaged. We'll move to a shared agenda by month 3 to 4. And again, that helps to establish the expectations, the continued organizational structure. We'll also do some priority development, and it's really important that as we think about priority development, we're not just leaving it wide open, but we're anchoring the priority development for the PFAC in the strategic plan of the organization. When it's too open, we end up with projects that aren't really relevant or valuable to the organization, and therefore you find kind of that drop-off again. So we'll be talking a little bit more about that. And then the outcomes from this continuous effort at improving your PFAC is that you avoid wearing down advisor leaders. Sometimes we get comfortable with those first 3 or 4 that we bring on, which is great, but we want to continue to build the numbers and the capacity so that we're not wearing those folks down. As you get more opportunities across your organization to engage your advisors, you're going to naturally increase your diversity as well, which is really a goal. Really hard to do within the 6 months of the Gateways program, but very important to continue to work towards. You're continually feeding the pipeline with fresh ideas and folks who have current experience in your organization. So in terms of agenda management, again, stay true to the structure, stay true to the charter that you've put in place, recognize that people will come in and out, that's okay. Even if it shifts in terms of your organization, maybe the point person or facilitator now may not be the right person 6 months down the line, or maybe they win the lottery and they move to the Bahamas. If the structure is in place, it's more likely that you can sustain those kinds of changes than if the structure starts to kind of fall apart. So, you know, again, attending to that structure and keeping that at the forefront for both your advisors and yourself really creates that true north. Again, staying connected to the strategic plan. So the agenda co-design by month 4. That's to give your advisors an opportunity to continue their learning about your organization. You've done some wonderful orientation pieces. Maybe you're bringing in different departments from your hospital to you know, present to your advisors. So you're continually building their knowledge of your organization. Do that for the first few months, and then by month 4, they're going to have enough knowledge about the priorities for your organization to meaningfully co-design. If we do it too soon, that's when we get into kind of pulling away from the strategic plan, but more you know, out of context kinds of ideas and thoughts into that agenda. So that's the key piece in moving to the co-designed agenda. Give your advisors enough knowledge and information about your organization that they can do that in a meaningful way. So as you move forward, you're going to continue to build investment of your organization, investment of your advisors. Across the board, we want to continue to build the investments because we know that's what builds the capacity and the integration of your advisory council. So some strategies for building that organizational investment is to keep your referral list dynamic. So continually add departments or areas that you can disseminate your referral form to, so that, again, your potential advisors can self-nominate. But keep that referral list dynamic. So keep adding different areas, different champions that you meet across your organization. So if you're keeping up on that spreadsheet, you know, we'd really like to see you continually add maybe 2 or 3 new areas per quarter as you're continuing your recruitment. Inviting staff members to attend meetings is a great way to kind of demystify what's going on in these meetings. What are these about? How are they going to help us? It does that demystifying for your organization. At the same time, it provides more knowledge and information to your advisors. So that can be a really great way. You know, you just kind of continually building that champion base. So you want everyone in your organization to be aware and knowledgeable of the activities of the PFAC, and kind of how that work really happens. And then communicate your successes. And again, I'll draw you back to the small, medium, and big wins. Just as important that we document and keep track of our small successes. It's helpful to the advisors as well to recognize those small wins, because I have to tell you that one of the frustrations, especially of newer advisors, is, you know, why don't they just do this? Why don't they just do that? And change in healthcare organizations, as you all know, doesn't happen as quickly as we all might like, and that can become a point of frustration for your advisors if you're not celebrating the successes on the journey. And so that's a really key piece, is starting to figure out, you know, we started with 3 advisors, and 6 months later we now have 6 advisors, and we had 3 more requests. That's all growth. And so it's really important to communicate those successes both internally to your advisors and, again, organizationally to build that investment. That, it's kind of a snowball that you're pushing downhill. So some strategies to build the advisor investment. Connect them with the community of advisors, and I would welcome all of your advisors into the Patient Family Advisor Network, which PFCC Partners hosts. That's over 350 patient family advisors that are working in healthcare settings across the country. Just having a sense of community and a knowledge that others are out there in this role, and how can they learn. We're embarking on a collaboration with Smart Patients, which is a online community for peer support to support. They have so many patients and families involved in their network that were interested in this patient family advisor work, and so we'll be collaborating with them to, again, build that sense of community and about how those core competencies get expressed. Use it or lose it is really the key. You may find that using it means you're getting some low-hanging fruit in the beginning, but again, celebrating that, acknowledging those early wins is going to help to build advisor investment. We want to feel relevant. We don't want to feel like we're coming to a monthly meeting where we're getting a nice dinner, but we're having no impact. So oftentimes we need our facilitators to draw those lines of impact for us, because it's difficult for us to necessarily see those. Continue to build the culture of collaboration, and I think the best way to do that with your advisors is to be very transparent about this being a new effort for you, and so create that co-learning environment within your advisory efforts. And communicate. That's really how we as advisors begin to feel connected to the organization, integrated. Communicating agendas and minutes ahead of time shows intentionality, shows investment of the organization, and the more you can demonstrate that, the more you can demonstrate, oops, my slides are moving, the more that your advisors will invest as well. Do I still have the control board? Okay, here we go. So use it or lose it. How do we integrate advisors into committees or projects? Essentially it's about creating a process, if you will, that removes barriers, that creates those clear expectations around participation. We want to move advisors and provide them any additional context they may need. So if there's more preparation, if you're doing a lean event around discharge planning, how does lean work in a really quick overview, and what specifically are the goals of this work team? So providing those additional information, remember, context is everything. Line up people's interest as much as you can with what committees and work is available. And so if someone is passionate, most of your advisors will have areas of interest and passion that you can really put to use if you know about them. So in getting to know your advisors in those first few months, learn what their interests are so that you can match them up with committees and projects that are moving forward in your organization. But that additional preparation is really the key piece to successful integration. And that goes as well for preparation of the team that you're onboarding. Let those teams know what the role of an advisor is and what it isn't, so that you're kind of level setting, if you will, before advisors engage onto those work teams. Here's just a slide to sort of get you thinking about some areas that you might integrate patient and family advisors. And they're sort of color-coded in terms of where you need additional you may need additional training, and then where you really maybe need some experience with that expert level. So you can, obviously, starting with the advisory council, which is where you are, lots of organizations feel really comfortable engaging advisors into facilities design, and that's a great starting point. If you get some early wins out of that, then you can build on that, and that's fantastic. Staff appreciation efforts, that goes a long way to building organizational investment. So if, I know for us, I think I shared with you all my early time on the parent advisory board at my kids' hospital. We were viewed as a bunch of angry moms, and at times that was how we were behaving. So in our effort to reinvent ourselves and increase the investment of the organization, we did a staff appreciation event. We made cookies and brownies, and we brought them to the staff, and we created a Parent Choice Award and acknowledged staff members or volunteers who were really emulating the core concepts of patient and family-centered care. And so that can be a really great way to increase your organizational investment, but also your advisors feel really good about that. You know, it's kind of a win-win. Document review is okay. It's good. Review is a place to start, but we're really pushing upstream to co-design. And so 10 years ago, 15 years ago, we were really happy to get to review and revise, but now we really are moving further upstream and finding that the efficiency of doing so is really meaningful to organizations, right? If you're designing a patient portal and then you bring it to your advisors and you have to undo, you know, it's much more efficient to start at the outset with advisors. Quality and safety initiatives that you all have going on, advisors would benefit and have bigger impact if, again, they've moved down that line of understanding and building context within your organization. There's a tremendous amount going on in patient-centered outcomes research, and so that's another area where, you know, folks may have a passion around improving care for geriatrics and EDs, and so they're participating on that. That can be another area. So just to get you kind of broadly thinking about all the different ways. I do want to call out peer support. Peer support and advisory efforts really go hand in hand. Peer support in healthcare situations is invaluable. I can tell you that from my own personal experience, and I can also share research with you. And peer support can look like a mentoring program. It can look like a support group. It could look like an online support group. There's many different ways, but the peer support groups, or peer support programs rather, naturally feed your advisors. So it's a natural recruitment area as people get support and as they get more confident and calm, confident, and comfortable in their roles. Those become sort of natural advisors, and the ESRD networks across the country have done this exceptionally well and really intentionally moved their peer support leaders into advisors. So if you want more information about how that might look, we'd be happy to connect you. So we talked a little bit about priorities development. How are we going to manage the priorities for the PFAC? Timing is, again, after they have some understanding of your organizational structure. Too early and not enough of that base knowledge, and we end up with priorities that are out of alignment with the strategic goal. So, you know, checking for knowledge is really important as you are moving through with your advisors, and you know, asking open-ended questions and just sort of assessing what they've understood from your orientation and from those first couple of meetings where you're really creating that knowledge base. Drawing back to, and it's in, you know, all across your charter, but drawing back to those biggest priorities in your strategic plan, and then providing that as the framework for their priority setting. So that, again, it's feeding Patient-family advisors are a key strategy for meeting your strategic goals. So providing that framework once again as you begin the work of priority development. And then how you do that, there's a number of different ways in terms of the sort of the activity. One of my favorites is to do a DOT system and have people brainstorm ideas of programs that might be supportive of your strategic goal, get all those up on paper, and then have a voting system of red, green, and yellow dots that your advisors could use to voice their opinion of the priorities. Something like that, if you're not comfortable with that one, but something along that lines that draws out your quieter advisors and also continues to engage others who, so that you're getting the focus of the whole group. So some indicators of success. How do you know you are moving down the right path? If you've identified and addressed issues or changes in the structure of your PFAC, okay, so if you recognize now that you started with every other month meetings, but you really need every month because it's the advisors are ready to go and they're moving you forward. So if you've addressed that change, if they've started to inform the charter, those are all indications that you're having success because they're very invested and you're growing your structure. Is the communication plan that you developed in the charter and outlined, is it working for both your organization and the advisors? We have an advisory evaluation tool that you may decide to use or help you to ascertain that, but it's critical even more informally in your advisory meetings to know if that communication plan is working, because as we talked about at the outset, how information comes into the PFAC gets worked on and how it goes out from the PFAC, and then that final piece, that follow-up. Find out, are your advisors getting that follow-up in a way that's meaningful to them, that they can see those small wins and progress. That's really important. So again, whether you evaluate that formally at the end of your meetings or whether you have a conversation about it a little less formally, really important that you keep your finger on that pulse. Are the engagement opportunities expanding? Are you getting more and more requests for advisors to join work groups or to join lean events? That's a great indication of success, and we'll be talking a little bit more about how you can manage that system as well. Is it becoming clearer to you as organizers how advisors will inform improvement work at your organization? So in other words, has your vision for the impact your advisors will have, has that grown and expanded over your interactions with your advisors? So often we hear of staff members just having these wonderful light bulb moments of saying, wow, now I can really see, how advisors could inform all of our work. I thought it was just going to be about patient experience, or I thought it was just going to be about the patient portal, and now I see that they really could have, that they have this valuable voice that could be applied to all of our improvement work. Continuing to build that champion space, and do your advisors have a good understanding of the work of your hospital? I apologize for that typo. Do they have a good understanding of your work, of the organization as a whole, and how, again, improvement gets done? If you can answer all of those in a yes, then you are moving down the line of success, and that's a very exciting time. So how do you manage all that growth? I would strongly suggest you let the PFAC members settle in for at least 3 months. Let them kind of get comfortable in that role, work out any bugs you have around that role, any bugs you might have in the charter, and just let them sort of settle in while you continue to recruit. I encourage you to batch those referrals. So once you've launched your advisory council on the initial launch, whether you have 2 advisors, whether you have 5 advisors, I encourage you to hold those referrals, continue the application process and maybe even the interviewing, but have in mind a date at maybe 6 months where you're going to onboard new members. That's the way we grow these advisory councils in the numbers, because if we're continually onboarding people monthly, it gets a little bit confusing for everybody because not everybody gets the orientation at the same time, and it just becomes a little bit confusing. So it also kind of inhibits the growth of the group you have. So if you're consistently bringing on new folks, it changes the dynamics every time, versus if you batch them and onboard new members at maybe 6 months, maybe 9 months, and 12 months, then you can grow those numbers in a way that is comfortable and in a way that doesn't interfere with the progress of the agenda items that you have moving forward. The other opportunity that presents is to get your current advisors involved in some of the interview process. If they have that time and inclination, that's a really great way to both include the current advisors as well as give a comfort level to the interviewees that your first group maybe didn't have. That can be really useful and helpful as well. The other thing that doing it in batches, bringing on new members in batches does is it kind of, you can prepare your advisors, even from the outset of the first meeting or the second meeting to say, this is a growth process. We intend to have, we're targeting whatever it might be for you, 10 members, 12 members by the end of the year, so we'll be onboarding new members. Giving them that idea up front and that heads up really dispels any frustration or any questioning of the advisors thinking, well, are we not doing a good enough job, or are we missing, whatever it might be. So again, just kind of less previewing, I guess, that idea. So challenges do arise, and so here's just a couple of them, of the more common challenges. That advisors stop showing up. If they stop showing up, it's really important that you get in touch. Work to get in touch, to identify what's going on with that person. If it's a personal crisis, or they didn't, they came into it thinking they were ready but they weren't, or they've got, their family member with a health issue is, in higher need, there's really not a lot that you're going to be able to do. And so that's, again, when we go back to building the structure and not focusing so much on the who. So you're going to continue your recruitment. You're going to have these other options available to you. Reasons like, I don't feel like I can contribute, or I don't understand what I'm supposed to be doing. Again, request that exit interview and look for the gaps. Where did you feel like you provided that information or that insight? It may be in your orientation program, or maybe in your communication loop. But if your advisors aren't feeling it, then there's some gaps there. And so really work through to see, where do you need to provide that information? Or maybe you need to change the way you're providing that information so that it really resonates with the advisors. You'll notice I'm not suggesting that you reach out to convince them to continue, but rather you want to use that opportunity to continually improve your process. When someone dies, I put this up here because it happens, and I can tell you, one of the advisory councils that I worked on early on, we lost several of the kids from that advisory council, and it impacted the way that the council moved forward. These are patients and families, and they're patients and families with health concerns, and so this does come up, and I want you to be aware of that and have a discussion with your team early on about, how are you going to manage that? Are you going to reach out? Are you going to have that advisor continue on the council, or are you going to have them take a break? Are you going to leave it up to them? when it happens is not the time to try to figure all that out. So really encourage you to set that up, talk with your social workers or your chaplain services so that they can come in and provide support to your remaining advisors. This can derail a council for a year or more if it's not really addressed and supported. So I want to open up the lines here a little bit just to ask more from you on the phone. What are the challenges that you're concerned about when you're really integrating your advisory council members?
Hi, Libby. This is Roberta. One of the things that I think has been significant to us is the complexity of the organization and the complexity of affiliate work and some of the system work. And we're finding that even as we present to, let's say, an established hospital team about the subject, we have to go through it several times to get our points clearly articulated. It's not easy because these are things we haven't done. But yet once we really get some success, so last week Morgan got a request for patient feedback on My Health Online. It's an electronic system we use for patients to schedule appointment and communicate with their doctors. We had 7 patients join that call and provide feedback that was incredibly insightful. And the product was written with terms like, you can now access your progress notes. And one of the patients said, what were progress notes? That's a physician term, not a patient term, right? Those are my notes. Or what's the reason for the visit? And the patient said, why don't you say what matters to me today? So, you know, it's very helpful, but now that is like catching on fire, and other people are getting the idea that this is a service we can provide. But initially it was very difficult to share the concept of this or how it would work.
Yeah, and I think that's fair, right? I mean, even as leaders in this work, you guys are new at this, so it is difficult to kind of convey the opportunity in front of us in a way that makes sense to the organization when it hasn't been embedded before. And so I think that's, you know, again, leaning into your early work with your vision statement and tying it to what is important and known in your organization, being the strategic plan, is really helpful. Great.
Roberta, this is Boris. I'm reminded of when I was at Children's Hospital in the past. People, when I first onboarded, people as a staff person told me, oh, it's going to take you 2 years to really feel like you kind of know what's going on. And after 2 years, I reflected on that, and I thought, man, I still kind of, in many areas, don't know what's going on. So I think this is a very valid, very real issue, that our organizations are so complex that often we who work within them, who speak the language, so to speak, are sometimes having a hard time really grasping all the complexity. And so I completely relate to that challenge.
Great. Any other challenges you're concerned about as you encounter your advisors?
Hi, Libby. It's Morgan.
Oh, go ahead, Morgan.
One challenge that we've been talking about is when you have a patient join a team, you know, so like a lean project at an affiliate, or join a standing committee or whatever. How do you kind of, I know you've talked a little bit about it at the orientation, but on kind of a one-to-one level, kind of talk through their role on this committee, you know, to bring the voice of the patient and all, you know, we have those kinds of, but it's kind of almost an abstract way, you know, and so kind of describing without sounding too like parent-like that don't be entitled or something.
Right.
we want patients to feel like they can speak their minds, but that just because they have a suggestion, it might not be taken on board. So how do you kind of prep an advisor that's kind of what I'm worried about, is how we're going to prep all of our advisors to join committees or projects, and then have them actually be successful in that project. Especially when it's new, I kind of feel like it's a first impression thing, so I feel like the pressure's on to the first time a patient advisor's on a project that they need to be successful on it. I don't know.
Right. No, it's a great point, and I think you can lean really heavily into the core competencies of an advisor, and maybe create some specific examples that ties those ability to establish partnerships, the constructive collaboration into the content of that work team. Does that make sense?
Yeah. So maybe that's a tool that we could kind of work on.
Mm-hmm.
Okay.
Right, and then just providing, again, context as much as possible. What is the point of that group? Giving as much information as possible, but leaning into the role of what is my role as an advisor, and what does that look like? We use a lot of scenario-based learning with advisors to prepare them for those situations that might get a little bit sticky during that collaboration. And give them an opportunity to be thoughtful about that and practice that, with you beforehand even. That can be really a useful strategy as well for dealing with that.
Cool, thanks, Libby.
You know what I mean by scenario-based learning?
I think so.
Yeah, just, role-playing, I guess, but coming up with some examples. And we certainly have plenty if you have any difficulty coming up with them. I think the other thing I didn't mention on an earlier slide that I'd like to mention as you're talking about integrating advisors onto teams, the kind of gold standard is to send them in teams of 2. And that's so that it increases their confidence and comfort level. And really that comfort level is important in terms of keeping them, in context and relevant and all of those things as well. So as best you can when it's possible, and I know early on in your advisory efforts it's not always possible because you only have, 2 or 3 advisors, and so that's okay if you need to move one in singularly, but you as a facilitator need to take the earliest possible opportunity to debrief with that advisor and talk about, what information they needed, what additional information might have been helpful, all of those sorts of things. And it's very useful for the facilitator to attend the first encounter with the advisor if you're sending one as well. Any other challenges you're concerned about? All right, we will move on then. So how do we troubleshoot? We've talked about challenges with the structure, we've talked about investment, but how do we troubleshoot with advisors? Advisors who get stuck in their own experience. Again, we revert back to the core competencies of advisors and moving them into that representative voice. This is a big challenge, and we've encountered this with even some of the most seasoned advisory councils, that there needs to be an intentionality behind moving someone from, we're inviting them in because they have a patient and family experience at your organization. So that's how they came to you, got referred and recruited. But the work is about moving from that individual patient experience into the role of advisor, and so there has to be some intention behind that. If you're finding that a lot of your advisors are getting stuck in their own experience and maybe not moving forward, go back and revisit those core competencies and connect them with the PFA, larger PFA community. Do those things so that they start to see themselves in that role. It's natural that as I connect and partner with you, that I'm most comfortable in my own role. But we want to continually make that effort to move folks from their own experience into that advisory role. They're not volunteering, so you have people on the side who are, kind of on the sidelines, if you will, not volunteering for any of the tasks that need to get done. Check for understanding, number one, that the tasks are clear, the demands are clear, and then if you consistently have an advisor who's kind of on that, in that background, I encourage you to speak to them one-to-one offline, outside the meeting capacity, to find out what the obstacle might be for them in volunteering. It may be that they don't have additional time, but it may be something that there's a lack of confidence there that you can be supportive of, or they aren't really clear that that was part of sort of the plan. And so having that one-to-one meeting, it can be really helpful. Getting frustrated because things don't move quickly enough. That I think this comes up at one point or another for most every advisor. It probably comes up for all of you as well, right? That's one of those things that we have a shared struggle in over healthcare. And so, really thinking through very transparently what it takes to make a change in an organization. You can take one that you've already made and just demonstrate, lay out for them the levels of approvals that were needed, or whatever the process was to initiate a change in the discharge program, whatever that might be, but really lay that out very visually and in a way that demonstrates the complexity of making change in your hospital and healthcare organization. Martha Hayward from IHI has created this wonderful activity called Why Don't You Just? And so she breaks up advisors into hospital CEO and hospital CNO and nurse on the floor and director of quality, and they tackle a problem, and from each of those perspectives the advisors are taking on those roles and saying, oh, we can't just do this because it affects nursing, we'd have to staff more, we'd have to do this. And so that can be a really helpful tool as well. Advisors who are consistently emotional, there's folks that are just emotional because they're emotional, and then there's folks that aren't ready for this work. And so, again, you want to pull them aside, and with each of these trouble spots, you really want to have a one-to-one conversation rather, as well as sort of build in into the agenda any additional pieces that might be needed in terms of education. But someone who's consistently emotional, who you are seeing is maybe just not ready for this work, provide an option, whether that's to be an electronic advisor or whether you'll get in touch with them for an interview, but acknowledging that this seems to be really heavy for them, and moving into a different option might be a better choice. Most often when I've encountered advisors who are consistently emotional because they're not quite ready for this work, they're incredibly relieved to have you say that, because they feel like they got into this commitment that they made and they know they don't want to be in it anymore. It's not a good fit for them, but that's sometimes difficult to come up with, so it's important for you to kind of initiate that conversation. Someone who consistently dominates the conversation, the quality of facilitation is really a key to avoiding this issue repetitively, because this will burn out advisors who don't feel like they can be heard, or who don't want to listen to this one person drag on and on and on in your meetings. And so if your facilitation skills are, if you don't have a lot of confidence in them or a lot of experience in redirecting and using some activities to dispel or to rather engage advisors across the board, then there's lots of tools online available to really pump up your facilitation skills. Those of you working in hospitals with social work departments, they can be a great asset in helping you to develop those facilitation skills. But it's important that you can redirect in a way that's effective and not insulting. So I think one of my best ways is just calling out on the quieter people, do you have something to add about that, or what do you think of what so-and-so has just said? Some of those really kind of easy techniques can be really helpful. But again, look at your facilitation skills and increase those. You will need those for the advisory council. So troubleshooting some group dynamics. There's too much conversation without movement. Refer back to the charter. That's what it's there for. And you can kind of call out, are we having the kind of impact that we want to have? Or are we having a lot of really robust and wonderful conversation, but it's not really tying into our strategic plan and it's not really helping the hospital to move forward? Refer back to that. If there's not enough conversation in your meetings, if people are quiet, oftentimes they don't understand and nobody wants to say that they don't understand. Or they may not understand why this item is a priority item for the hospital or for the organization. They may need more information about how that relates to what patients and families experience in your organization. Or they don't see how they can contribute. I think a lot of advisors, especially who are new, there's so much of this is in the conversation and the shared conversation. It's not always clear to me, even now, on some of the work groups that I'm working on, it's not always clear to me how I'm going to contribute at the beginning. But if we keep engaged and if we continue to be active in that collaboration, those pearls come out and we're not really, sure. So continuing to reassure the advisors that it is their experience and their experience only. That's the expertise they bring to this collaboration, that they don't have to have a great understanding of all things healthcare related, but that they can speak to, they are knowledgeable of their experience and knowledgeable of that representative experience of what it's like to be a patient or a family member in your organization. So again, increasing that confidence over time and being really active in that effort is how we troubleshoot some of these group dynamics. The continuous improvement piece, it applies to your work with the PFAC as well. So again, implementing the gateways as a wave and building momentum over time, that's how we increase that investment. It's how we increase the numbers of advisors. Continue to dedicate staff time and resources. We talked at the beginning of the Gateways program that when we got to the completion, that was really the launch. So the time and effort your staff members are going to need to put into this effort continues and actually builds maybe over time. The need to spread your enthusiasm is key to continually improving, continuing to demonstrate your commitment to partnering with your advisors and creating authentic avenues for engagement across your organization. Acknowledge again, being transparent and acknowledging the difficulty of starting something new. This is a really new way for your hospital to work. And so acknowledging that and not feeling like you have to have all the answers as an organization. Your role is to make space for your patients and families to come in and inform this and co-design this advisory effort with you. As much as you can, present information in more than one format, that continuous improvement piece as well. And just always maintaining your inquisitiveness and continuing to open those conversations with your advisors to learn more. There's always more to be learned about these efforts, not only within your advisors, but within the larger community of Patient Family Advisory Council members. So how do we manage success? Whoops. I mentioned a little bit earlier that as you start to gain traction in your organization, you're going to get more and more requests for your advisors to participate. And that's a great sign of success, a great sign that you're really getting integrated into your organization. I would encourage you to create a request process. That can get overwhelming really quickly. As you start to hit the tipping point of this work in your organization, you'll suddenly get a volume of requests, and you're going to want to have a process set up ahead of time to manage those. So, what criteria are you going to use for taking on requests? How are you going to prioritize those? Creating that sort of decision-making tool for yourselves ahead of time, so that the most important thing is that we're not appearing to be show any favoritism. So when requests come in, we'll get our project to the advisory council because I know so-and-so who's facilitating it. You want to remove that so that everybody in your organization has access to your advisory council in a way that makes sense, and again, that is tied back to the strategic plan. Always keeping, like I said, the finger on the pulse of your communication loop. Make sure it's working for you as a facilitator, for your hospital or healthcare organization, and of course for your advisors as well. That's probably the biggest key to keeping all of this moving forward and growing your efforts over time. Continue to track your integration of your advisors. Lots of organizations are going to creating an annual report for their patient family advisors. Some are moving to the impact report. Those are great, but you need to be tracking even from the beginning where those integration points are, so that you can, obviously inform that kind of a report. So here's a simple request process that the facilitator receives the request. You establish alignment. That's that piece to how does this particular project feed the strategic goals of the organization and the priorities that the PFAC have developed. Is there alignment there? And then create some matching in terms of your individual advisors, who's going to be the one that kind of moves into that project. Provide the preparation, the additional preparation, as we've discussed, for both your advisor and the project team, and then track those activities and track those outcomes. This process will give you a volume of information as you integrate your advisors further into your organization, and it gives you some real data behind your efforts, and that increases the sustainability in your organization as your leaders start to see the impact and effect of your advisory councils. So moving forward, it's important to go back and, as a team, look at the objectives for the Gateways program and reevaluate. Where are you? Which ones have you met? Which ones have you not met? Or which ones are you on the way to meeting? And what additional resources do you need to get there? And it's I think a really good opportunity for you to do this prior to the capstone event, so that as we have more time together, we can provide you those additional resources. And then some team action planning. I know that we'll do more action planning at the capstone event, but one of the ways that we do some of this planning ourselves, as well as encourage our organizations to do it, and we've done workshops with several hospitals around just kind of doing a brainstorm, again, where you get all of your team members' input, but doing a brainstorm about what do you need to stop doing right now in your organization to continue these efforts? What do you need to do, or expand these efforts, I should say? What do you need to do in your organization to continue doing? What are you doing now that's working to support the integration of advisors in your organization? And then what do you need to start doing? What have you not gotten to yet that are sort of the next steps for you? And I think that can be a really helpful way of doing some sort of action planning as well. And that will inform your efforts moving forward to the capstone event. So one piece of information that I would really appreciate from all of you on the call today, as you think about the Gateways program, what piece of advice would you share with a future participant, a future team going through the Gateways program? What would be helpful for them to know at the outset? What do you wish you had known that you know now? Nothing?
Libby, is this something they could also give feedback later on as things come to mind?
Sure. Of course.
You know, this is Roberta. One thought that I had, we were very fortunate that we were able to get out into the community and get quite a few participants, and I think that's often hard. As we start our work, we look internally to some of the patients that have been in our facilities, or we have brochures up in the elevator or in the waiting rooms. But I was surprised. We went out and did one community event and recruited 4 patient-family advisors. So I think it's getting out there and making it available, and you really can't fail. You go out and do a 10, 15, 20-minute presentation and hand out some brochures, and you get the word out that this is important to your organization.
Mm. Great. Thank you, Roberta. All right. Well, we certainly always value the opportunity to continually improve for our program ourselves, so I would encourage any of you to send along your thoughts in this way. That would be helpful. And with that, Boris, I'll turn it back to you.
Awesome. Thank you, Libby. And Morgan also added for the piece of advice that she would keep things simple. It's always a good goal.
It's hard to keep things simple in such a complex healthcare system. That's for sure.
Yes. And so very quickly, I'm trying to figure out if I should apologize for ending about 9 minutes early, but I think you will all forgive us for that. And you have your evaluation here on top of your screen. By this Friday, we need your capstone event slides and any other presentation materials sent. And if you need an extension, let us know. And we want everybody to register for the capstone event. And if you have a desire for additional one-on-one coaching, call Nicole. So those are the key reminders at the end. Any last comments or questions about any of the content or capstone or anything? And hearing none, I would like to thank all of you for taking the time today out of your busy schedule and joining us. And I'd especially like to thank Libby for sharing her knowledge and experience with us. We look forward to seeing you on the 16th. And thank you all, and have a great day.
Thank
Bye.
you.
Thank you.